after 14 days quarantine, saying goodbye to my room. But my chariot awaits. India's healthcare system is a bit of a paradox. On the one hand, you can get access to some of the best doctors and hospitals in the world. That also attracts medical tourism. Yet on the other, according to IMS Health, 63% of this country's population do not have access to affordable and quality healthcare. That's over 800 million people. The healthcare landscape is evolving though, driven by the government, medtech companies and private healthcare providers. And all this amongst the backdrop of a surging COVID-19 virus that places India number 2 in the world when it comes to confirmed cases. Now, Nal Gollagunta, or Nal as he's better known, who I'm here to see, was the former CEO of GE Healthcare South Asia and has been deeply involved in India's healthcare transformation. Nal.
Hey Mikey, how are you?
Not too bad, how are you?
I'm good,
Let's
thanks.
do a little bit of a, this is the COVID handshake.
That's right.
So, look, India, its healthcare system.
Yeah.
Let's go back pre-COVID.
That's right.
What were the major challenges?
Listen, this, our journey here starts almost 30 years ago, and you're talking 1990. Universal healthcare was a vision and dream we couldn't get to. And more than the affordability, the accessibility was a critical challenge. And our journey at that time and the vision for us was, what can we do to solve this multi-part puzzle? It's not just cost, it's the whole thing.
What are the key aspects that you focused on in order to overcome those challenges?
Yeah. So firstly, a couple of things. When we started this journey, we were about 900 million people, and not just India, it was the region. So you have Bangladesh, Sri Lanka, everything put together. Today we are over 1.5 billion people. So you're talking of a fifth of the population of the world. So in 1992, just about a kilometer down from here, our first factories came up, which gave us that interdependence and independence on what we can do with healthcare equipment in the country. We started with CT and ultrasound at a time when all these were imported into the country. It was a huge, huge step for us. Then what do we do in terms of designing it? And that's how this place where we are, it started, which is how do we create the center which can start to design products for the country, for the region, specifically solving the issues that we had to do. So the journey started with the machine, but then it went on to saying, what do I need to do from a services perspective? What do I need to do from a sales perspective, right? So we had to innovate on those dimensions as well. And one of the innovations we did was around what we call public-private partnerships. You get a partner who goes into a government hospital, sets up the machine, and he gets paid per scan. So we had to innovate this model with several different ecosystem partners. We started that journey in 2002 with our first center in Rajasthan. Today, we have more than 150 such centers. Right?
Wow.
And we do about 4 million scans per year in these centers. The third thing we did was, how do we go to the other 400 districts? And one of the things we did was, we spun out a small company which only focused on distribution in the 400 districts which we don't reach. If we just walk down the bay here and we'll just show a little bit of the testing and some of the infrastructure we have in place.
You know, GE just doesn't rock up inside India and start operating. You know, that is it's a mammoth challenge.
Yeah.
How do you get a foothold in a very different country with a very different demographic, with a very different challenges?
This journey starts 30 years ago, and it starts with Jack Welch. And then he came to India and he said, listen, this is a country of promise. This is the superpower of the future. But I really need a local partner who has the same mindset, same value system as us. And Wipro brought that expertise. Not just expertise in terms of technology, them being a technology company, but also of the local market, understanding the local population.
How are you navigating the issues and the challenges that are thrown up by COVID-19?
Yeah, so as a CEO, you have a lot of playbooks you work with. This isn't one we had a playbook for. And we went through probably the harshest of lockdowns of all countries of any size. And we really had to figure out a way to make sure that we keep our operations running, ensuring the customers and patients had what they needed. Making sure our machines, which are out there, those machines are up and running and ready whenever the COVID tsunami, as we call it, starts to hit these hospitals to that extent. And second was to make sure that we're delivering more equipment, which was needed desperately. We're installing them, we're continuing to train the technicians on that. So right through the journey, through the lockdown, which lasted for almost 3 months, we had close to 5,500 service calls we had to do. Absolutely go there, fix the machines, make them they're running. Wow. We had to deliver 700 pieces of equipment uninstalled through a lockdown, right, when pretty much everything was shut down in the country. Manufacturing centers had to be running as well. We couldn't miss a bit on that because a lot of our factories globally were reliant on some of the pieces we're making here to be delivered there. So we had 4 times regular demand on X-ray generators, wow, suddenly, overnight. And this was not just our products. We had close to 75 suppliers all over India who were supplying critical parts for some factory somewhere in the GE system to that extent. The government was extremely helpful. They understood what we were trying to do. And in fact, that's the time they realized how much of roots we had put into the country in terms of work we were doing here, not just for India, for the globe as well.
What is it, from your analysis, from your experience, that has become a big player because of COVID-19?
Yeah, listen, if you were to think about it, if there's one single concept, it's digitization. And what digital can do for us in terms of not just COVID, but really a realization that it can be a huge game changer for us and a force multiplier into the future. So the whole bunch of science projects we were doing in the past, all of that now takes center stage for us. And we think that going forward, there's going to be absolutely the core part of how we're going to drive the future as GE Healthcare and Wipro GE in India.
It's been an absolute pleasure talking to you today, and best of luck with the next chapter.
Oh, thank you. And as part of my new job, I'm going to be leading the digital charge for GE Healthcare as well. So looking forward to it. Thank you for coming here, Mikey.
That sounds like another story, and I look forward to talking again soon.
Thank you.